All C-Qual breastboards accept breast thermoplastic for enhanced breast positioning. This setup requires either a 2.4 or 3.2 mm standard perforated or IMRT reinforced thermoplastic sheet and a breast support handle system. First, determine where the thermoplastic sheet should be attached to the handles by comparing it to the patient's anatomy. The handles offer 5 different sheet positions to choose from, depending on the patient's torso length and breast location. Once the sheet is secured between the handles, it is now ready to be heated in the water bath or dry heat oven. Times will vary dependent on your heating source. Position the patient onto the breastboard with their affected side close to the breastboard's lateral edge. This position will help ensure that the thermoplastic sheet forms closely to the patient's chest wall. If using the Monarch overhead arm positioner with the C-Qual, the patient position will remain more centered. Once the proper setup position is confirmed, the 3-point reference marks can be applied as a guide for the patient's daily repositioning relative to the breastboard. The C-Qual's lateral indexing scale provides an additional reference point. Note: the breast to be treated can be taped into an upright position beforehand to aid in the setup process. Pulling the breast thermoplastic requires 2 therapists. Remove the breast sheet from the water bath or dry heat oven, being careful not to overstretch the sheet. Begin by docking the breast handles on the ipsilateral side, handing the other handle over to your assistant on the contralateral side. Begin lifting and shaping the affected breast into an elevated position, making sure that the breast tissue is not shifting from underneath the sheet. On the contralateral side, position the breast down and laterally to create a clear medial beam path. Press the sheet down upon the sternal region as well to prevent the medial breast tissue from shifting. Once the thermoplastic sheet is hardened, it can be marked to indicate isocenter. For additional repositioning, marks can be drawn on the sheet signifying the location of the areola or other identifying marks such as scars. Additional marks can also be drawn to aid in repositioning. For daily repositioning, align the patient back onto the C-Qual according to their setup sheet and reference marks. Dock the thermoplastic sheet first on the ipsilateral side, and as the sheet is brought over the patient, scoop the affected breast up into the thermoplastic mold, capturing it back into the cast. Next, dock the contralateral side in place, compressing the breast back into position. Ensure all breast tissue is properly contained within the thermoplastic sheet. Utilize all additional marks to ensure proper alignment between the patient, breast tissue, and the thermoplastic sheet. If you need further assistance, CQ Medical offers in-person and live web-based trainings and product demonstrations, and we have clinical specialists around the globe to support all your needs. CQ Medical. Care smarter.